If you have reasons to smile but are feeling self-conscious about having the right smile to go with it, Dr. Andrea Joy Smith is helping patients achieve an ear-to-ear grin to share with the world. Dr. Smith is with us live now to discuss treatments she uses in her dental practice to help her patients. Good morning, Dr. Smith.
Good morning, Aubrey. How are you today?
I'm doing well. Dr. Smith, in the past, we've talked a lot about your modern approach to dental implants with mini dental implants, but I hear that you're also using another treatment that we don't normally associate with teeth.
Absolutely. I wanted to talk today about using Botox for therapeutic reasons to treat tooth problems. Patients unknowingly sometimes grind their teeth, and that leads to tooth wear, tooth destruction, and a lot of muscle and jaw pain. Normally, we spend just a few minutes a day with our teeth in close contact with one another. But when there's constant grinding and clenching, the teeth start to wear away and become painful. And also the muscles that are associated with the muscles of the head and neck also become sore. And for that, we weaken and relax those muscles with Botox.
Oh, that's really interesting. And how long have you been doing this with your patients?
I've been doing Botox for my patients since about 2016. It's been around for treatment of things like migraines and other head and neck issues and other muscle related problems for well over 10 years now. And I find that a lot of reasons for me to replace missing teeth is because patients have either cracked their teeth due to grinding and clenching, and so we often have to remove the tooth and replace it with an implant.
Oh yeah, and if you don't have to do that, you don't want to. Now talk about the importance of treating people who clench and grind their teeth.
Well, when we catch it early, we can often delay some of the tooth problems that come along with grinding your teeth. The teeth often wear out, they become shorter, they become sensitive because when you're grinding and clenching your teeth, you're slowly wearing away the enamel that is the protective part of the tooth. And so when that enamel's gone, you've lost some of the structure of your teeth. They become painful because now the sensitive tooth structure is now exposed where it wasn't before. And so the earlier we catch it, the better, and especially before you crack and lose a tooth.
Now, what was done before Botox traditionally for this condition?
Well, yes, that's a good question. Before Botox, we would often fabricate a custom mouth guard or a mouthpiece to be worn at night. That would, of course, protect the teeth. However, a lot of patients aren't really compliant with it. It's very difficult sometimes to sleep with an extra something in their mouth that they're not used to. And it also causes extra salivation. Now, this also protects the teeth because there's plastic covering it, but those muscles are still allowed to overwork and grind and clench, and that causes that muscle problem. So they wake up often with headaches in the morning and they don't know why. Normally it's because they're spending much of the sleeping hours grinding and clenching, wearing away the enamel, but also making the muscles very, very sore.
Dr. Smith, I'm going to admit that I have dealt with this issue with the grinding, and I actually have a night guard that I use. I've never heard about the Botox approach, so that's really interesting to me. And as we mentioned at the top of the segment, one of the things you always talk about here are the mini dental implants. Can you use that along with the Botox treatments?
Yes, I often do combination treatment because many times when I'm replacing a missing tooth, it's as a result of a cracked tooth that was cracked due to grinding and clenching. And so for those patients, when I replace the tooth with an implant, I like to use Botox to relax those muscles so that we're protecting the remainder of their teeth and we're protecting the implant as well. I always tell my patients, as good as implants are, your teeth are always better. And if we can protect them, that's going to make them more long lasting. So catching it early, and then once we realize that we have to replace the tooth with an implant, just be open about Botox. Botox in some ways kind of has a bad rap. You know, we think about people trying to enhance their looks, and it does have that very cosmetic effect that is still evident when I do the therapeutic uses. But for our purposes here, we're using it for therapeutic reasons, and it relaxes the muscles and gets rid of the headaches.
Right. So, Dr. Smith, I know you have lots of great services there, and you can help people achieve their desired results. And there are lots of benefits to getting that dental work done. Don't put it off anymore. Thanks for joining us this morning. If you want to connect with Dr. Smith and learn more on mini dental implants and her Botox treatments, you can visit smileagainnow.com.